Hey guys, welcome to Doctors Online Success. My name is Dr. Mike Woo-Ming, also joined by Dr. Truong.
Hello.
Hi, today we're going to be covering one of the self-limiting beliefs that we often see for physicians. We're delving into entrepreneurship, and that is that hospital and insurance-based medicine has this ability that other forms of revenue do not, that entrepreneurship is just too risky. So we're going to see if we can dispel that myth right now. And I know you have thoughts on this. What do you think?
I had that thinking when we were in med school and the residency training. Nobody teach us about business. We just know, hey, I'm just going to be the best doctor I can be, get the best grades. I'm going to come out, put my sign up, and everybody will come to me, right? And everybody will come to me because I'm good at what I do. Well, when you're out in the real world, it's not like that. People just don't come to you because you're a doctor. They have choices and you have to let people know about it. But we didn't know anything when we come out. And so when I've been out since 97 until probably 2018, I thought like that because I took insurance for that whole time. I was in my own business from 2000 to 2018. And we took insurance until we realized that taking insurance was making us less money. We were working harder and seeing more patients, but we were making less and less money every year. And we thought it was us when I finally realized that it was not it at all. We were getting more denials and our reimbursement were decreasing. And sometimes the denials reason was totally ludicrous and they just go, "Oh, sorry, it's our mistake. We'll just pay you." But that's like 3 to 6 months down the line. That's when it opened up my eyes, Mike, when I realized, you know what? If I go to a grocery store and I buy a bag of groceries, and I'm gonna say, "Well, I'll pay you in 30 days." That's what insurance does. That's what insurance company do to doctors. It's like you deliver the service, but you don't get paid right away. You get paid days or months later. That's it, if you even get paid. Doctors, I hope you know whether if you're an employed doctor or in private practice, you know that you don't get paid right away and that you don't get paid 100% either, because sometimes it could be denial that can happen when you're taking insurance. We have our own billing company from 2000 to 2018 when we did our own billing in house. And I learned all the intricacy and the tricks the insurance company does to deny you. Sometimes, if you're front desk person entering a patient's name and maybe the name was misspelled, they will deny you for that. If the social security number is misspelled, one number is not correct, they'll deny you. They'll also deny you if you have the wrong address or the address is spelled wrong. They'll deny you if you have the incorrect date of birth, and they'll deny you if you miss one number in the policy number. So there are many different modes of denial. It's all about entering in the data correctly. You and I, Mike, and your listeners, doctors, you're listening to this, you know that your staff do make mistakes. We're talking about human beings that are entering data here. Mistakes gonna happen. But if one little mistake happen, you're not gonna get your money right away. And so we realized that as when we were taking insurance, that we were getting paid less and less and less and more denial. So then that's why in 2019 we decided that we weren't gonna take insurance anymore. And guess what happened? We got paid right away. It's a nice feeling to deliver a service for a patient and then get paid the same day. Which to me, when that happened for the first time in 2019, it was a big revelation. And I realized that I was being a slave to the insurance company for a long time. But as doctors, we don't know any better. We weren't told anything. We weren't taught a business or entrepreneurship or even the intricacy of how insurance work until we're actually out working.
Yeah, it was funny. I was at a retirement party for a good friend of mine, he retired, and with the table, we were kind of assigned a table, and we were speaking to people that we hadn't met. And this gentleman, one of his sister's husbands, went into discussing about insurance-based medicine. And he says, I know a lot of physicians and they're getting burnt out and unhappy, and it's dealing with insurance. And he says, how do you guys let that how happen? I hear that insurances, you do all this work, and then insurances can deny something that you have advocated for this patient, deny certain imaging and certain treatments. And I go, it's not fun. And what's happened is we have this culture in medicine now where we're conditioned now to devalue our own services. So, when we used to code for, a 99, maybe we do work for like a 99215, but we downcode. We say that we do less than we actually do just in case we get audited or we get denied or anything like that. Even though you spent all this time doing it, we're so in fear that we're going to get audited or we're going to get declined that we just devalue it. And we know we all do that. We've all have,
I've done it.
yeah,
I've
we
done
all,
it many, many, many times.
yeah. And so that I think it just reinforces this pattern of physicians kind of devaluing of what we do. And imagine getting paid for what you're worth. I mean, and that's what we can do in an insurance free practice, in a cash based practice, in a DPC type practice for those who can go in that route. But I see this all the time that insurance based medicine is stable. But I know, and I'm sure you know, people who got furloughed during COVID because they felt that their career was not essential. And that was kind of a rude awakening to many of us where that happened. Even today, we see physicians who work in federal based hospitals getting their hours cut or maybe even losing their jobs. So it's not off always the hospital employed route is the safe and stable route.
Absolutely, because if you are taking insurance, the insurance company can decide one day, oh, you're not on our panel anymore, whatever, you overbilled it, and therefore you're not in network. You can get cut off like that. In 2018, in fact, I was audited by Blue Cross Blue Shield, and the reason why they audited us was because we were doing cortisone injection without having charted in the chart that they had failed conservative measures such as physical therapy and NSAID, and they had to have gone under physical therapy for 6 weeks and fail. And because we didn't chart that in the chart, even though they may have done it, it wasn't charted as the reason for the cortisone. Therefore, we were denied, and therefore we were being audited, that we were billing fraudulently because of that. Even though we delivered the service to the patient because we didn't chart that. Therefore, they were asking for repayment back for that. And that's the reason why I was like, I am getting out of the system. This system no longer value me because I'm taking care of a patient. My patient could barely walk. If I can give him something that will just alleviate it for just for the moment, even though cortisone may not be the long-term answer, but at least some pain relief. And here I am being penalized for doing something as a physician and treating patient and alleviating pain, but yet being penalized. I was also being penalized for giving patient hyaluronic acid because we didn't document failure as well. And if you're taking an insurance doctor, do you know the whole thousands of pages that you're supposed to follow, or for a diagnosis code you're supposed to use for a certain diagnosis or a certain procedures that are allowed to for a certain diagnosis? Of course we don't. You're not going to read those thousands of papers that you signed when you became a network provider or not. So like if you take an insurance, doesn't necessarily mean it's stable. And commercial insurance is based off of Medicare RVU. And so if Medicare payment is decreased, so is your insurance. Like you take Blue Cross Blue Shield, Aetna, or United, it's also decreased because the calculation, it's a percentage, the Medicare-based reimbursement. And I have seen that 18 years of taking insurance, we were actually seeing decrease in payment rather than increase in payment. And I can tell you this, if you don't give your employee a raise, at least cost of living raise every year, they're not going to be happy. But when is the last time? I can't remember this, Mike. I don't know you. When is the last time we doctors had a raise in insurance reimbursement? It seems like it's always a decrease instead of an increase.
It seems like every year you hear Medicare, I've never seen it go up. It always goes down in terms of
Yeah,
reimbursement.
right. Exactly. And I think that the mindset that doctors think that, oh, I have to take insurance. The only way I get paid. Take it from me, who I took insurance for 18 years. And when I did not take insurance in our first year, for me as a solo provider, I made more money than I did even with 5 providers because I had required less staff and I didn't have to chase for billing. I didn't have to pay a billing department at all. So, Mike, you've been cash-based practice for a long time since I was 2012.
Yeah, and what's great is there's some creativity in terms of like what we can do and what we can't do, but we get to set our own prices when we want to package our different products or different services. I enjoy that. I mean, there's always things that we could be doing or something, and it's good to having that specter over our shoulder saying what we can and what we can't do. As long as you're doing it ethically and morally, and I think that's what we all want to happen. And I think even taking a step further, not just based on stability, I think having one income is very unstable. I think if your income is just based on you, we see this all the time. Things happen in business and in medicine. Hospitals can collapse, practices can be sold to private equity, insurances come and go, different insurances, and there's a lot of people trying to get that piece of the pie. And I think now the way that you have stability is to have multiple streams in income, whether it be income from a book, income from speaking, income from a telemedicine company. I know a number of doctors who work in telemedicine, but there are a lot of different telemedicine startups on there. I would rely on just one telemedicine startup these days because of the variability in that income through affiliate marketing. And you are the queen of multiple streams of income. How many do we have now for you?
17.
17.
17 sources of income now that I'm remembering, but I'm sure I'm probably one I'm not thinking of, but around 17 right now. Aside from seeing patients in the office, that's one, but it's 16 sources that leveraging my medical expertise. I'm not even saying real estate. I'm not just leveraging all my medical expertise and like branding and affiliates and licensing and courses and membership and high ticket, low ticket, webinars, brand ambassadorship. I mean, the credibility that doctors command, people want to access your knowledge. Your knowledge is so unique and that we don't value it, nobody will. We have to realize that our knowledge and our expertise, people want that. People will pay for that. And people will pay a lot of money for that. I mean, just a reassurance that, hey, this pain in my chest, is it musculoskeletal or is it a heart issue? People will pay for your knowledge, as in course, even just hopping on Zoom with you and answering their questions, or even giving a webinar to a company with their employees and teaching them how to be healthy, leveraging what we know and what we think daily within 30 seconds of what's going on. People want to know about that because you can reassure them. What does doctor eventually give to patients? What is it that we do that is so invaluable that they cannot get elsewhere?
Me?
Yeah, what yeah.
Well,
Yeah, what
a
yeah,
care,
what is it that we do?
treatment,
Yeah.
treatment,
Huh?
care.
Treatment
Some of the
care,
listeners,
but reassurance,
reassurance. That is right. Yeah.
reassurance that we are okay, or the reassurance that, hey, you need to get evaluated. It's just a sense of relief, sense of reassurance. They
Yep.
cannot get that elsewhere. That is reassurance. What you take for granted, just listening to the symptoms and the history, it's not your heart, probably indigestion. Well, one of the differential diagnoses, chest discomfort, right? It could be heart attack. It could be GERD. It could be musculoskeletal. It could,
Anxiety. Yes.
right.
Well,
Anxiety. Exactly. Exactly. But what we're giving them that is invaluable, it's priceless, is reassurance that they're okay, or guidance, and even life-saving as well too. I give you an example. My husband was having headaches and differential. I was thinking of, well, oh my God, migraine, brain tumor. But we worked that up right away. It turns out it was from his heart. So he was having ischemia that was giving him the headache. But that was the last diagnosis I thought of. But his cardiologist thought of that. So when I took him to the cardiologist, who is our good friend, said he's been in practice for 20 years, and I had a couple of patients that presented as headache from cardiac origin. My husband went for a stress test and he ended up having a 98% blockage in his LCA in his heart. He had a widowmaker. The point is, what you're delivering is reassurance and life saving, and nobody else can do that except doctors with the experience and training that you have right now. And so sometimes, like you said earlier, I don't think we value that. We kind of undervalue ourselves because maybe the way we've been treated over the years with our training, just being pounded over and over again. And I would tell you, now that I've broken out the shackles of insurance, I just felt that I was a slave to insurance company and that I was not being a doctor. I was not making the clinical decision. It was being dictated by somebody else behind the scene who doesn't even know my patient. So is taking insurance a stability? Maybe for now, but you have to work hard. You have to see a lot of patients in order for you to even make a decent living if you're in private practice at this point. And I give in one of my webinars, I was showing the reimbursement compared to expenses. And doctors, after expenses and everything, probably net about $400, netting $400 a day after expenses and everything. If you see 40 patients a day, if you just saw like Medicare patient, and that's it if you get paid 100% after you bill. And so, not necessarily that when you bill, you're going to get paid. And also, if you have the correct insurance too, because sometimes patients don't even know what insurance they have as well. So, I guess the question we go back to is that taking insurance is the safest way, the most stable way for doctor to function. Well, I guess our answer is that's not the only way. There are other options. And also, oftentimes, when you go outside of the shackles of insurance, you actually end up making more money and be able to leverage your medical expertise to have multiple sources of income. I said Mike has a sponsor on his podcast. He's been doing his podcast. How long you done your podcast? For a long time, right?
This podcast I've done for about almost 5 years. Yeah.
All right, for 5 years. Yeah. So Mike did his own podcast for about 5 years ago, and that has given him opportunities where he had sponsorship, sponsored on his show as well too. So how should we end this then?
Well, I think we're just talking about this belief, and whether you like it or not, I think personally having one source of income is very scary. I think it's very risky. And then I challenge you to consider like what else can you do? What else is out there that can bring in revenue? If something happens, knock on wood, it doesn't. But I've seen doctors lose their job, on some trivial things, or hate to say, lose their license on different things. What else is out there? You never know what else is out there. And to think about stability is to think about multiple streams of income. I really honestly believe that.
And the way to do that is to break away from the insurance shackle at this time. So, having said that, I hope you find this valuable and just know that there are multiple ways to leverage your medical expertise and that you should value yourself and your knowledge. You work hard for it at this point. So, we will see you in the next episode.
Bye bye.